Anyway, Doctor, we are very grateful for your presence in our class. And as a class, on behalf of the class, I would all ask my students to give both the doctors a round of applause. Yeah, they're all, their voice is on mute. It's on mute, sorry. I put them on mute, so it takes time. So thank you from behalf of the class for both the doctors. I'm just waiting for my classmate, Dr. Rajan. I don't know where is he. Uh, and okay, Dr. Ahmed, welcome to our class. Uh, Good evening and welcome to India, Bangalore, and welcome to our class of MBA. And yeah, I haven't. Yeah, Doctor, you can. Yeah, yeah, yes, yes, Doctor. And one more thing I would like to tell you, Doctor, is we have this at 6:30. Some of my students have, that is Indian time. We have this fasting, and they are going to break their fast. So before maybe by 20-30 minutes, we can have a class, and then we'll go for question time. Yeah. Okay. So shall I give the mic over to Dr. Narendra? Okay, Doctor. Start.
So I had a mic loss in that, but I'll just try to tell you what Dr. Narendra was telling us. He was telling us that we should be using the doing following the precautions when it comes to having work done with respect to COVID-19. And what he said is we should wash hands regularly. We should be in a situation that we regularly avoid touching our nose. We avoid, you know, doing things with respect to spoiling our health by keeping ourselves unclean. So that's what it was all about. COVID 19 can spread by unclean behavior, by not using masks, and that's what Dr. Narendra tried to tell in a speech. And COVID 19 has been creating havoc in countries like US. I had asked him a question about how this disease has claimed so many lives in countries like UK, when and he told me it's and very less deaths in countries like India. What he told me was, in India, what has happened with this disease is this disease has not been able to wreak havoc in India. Maybe because the numbers are not reported properly. Maybe there is something else in this country which they don't know about. But one thing they disagreed on was they refused to admit that this disease can be or have been controlled by Indian doctors. Because if you look at it, you're talking about 1,500 deaths as on March 7th, which is very less, and a country like UK saying they have 35,000 deaths. So, as doctors in UK are into, they're into heavy pressure, they're into a lot of deaths, and as such, doctors they work in their profession, they have spent time to talk to us about this disease. And the mic problem, made I had made a notes in my understanding with this presentation, and those notes I have been able to share with you, and share the audio of this video. So that notes help me to speak about what the doctor is saying. And as you look in the doctor's face, there's a lot of is you know they are working from their workplace, and they're taking a lot of pains to tell us what this disease is done for them. But what he tells is, we should be in a position to properly keep ourselves hygienic. We should be in a position to keep others' health properly, and through this, we will be in a position to protect ourselves and others from this disease. So that's all what the doctor's talk was all about. And doctor had some time, very little time to spend with us, because he is also in the middle of his work here, and that's why we allowed him to speak first. So here, as you see, he's telling about covering face while coughing, sneezing. All these can protect us from diseases like COVID. And I was just looking at how the class is paying attention to all this, and I noticed that most of them have kept their cameras switched off. And I had one of my students, Rajeshwari, asking questions to Dr. Narendra on his her understanding of the mask. And what the doctor said is, masks need not be worn by everybody. Mask only, the normal face masks are enough. Maybe even a normal dupatta or a normal kerchief can cover the face, and it can protect the person from these germs getting into the body. So that's what the doctor had shared with us in his talk. And then the mic was given over to Dr. Ahmed, and Dr. Ahmed had a presentation waiting for us. Now, Dr. Narendra works for UK group of hospitals, and UK, even in UK, you had even their Prime Minister Boris Johnson being admitted in hospital for COVID-19. And as you look in these doctors' faces, they have a lot of tensions and they have a lot of worries, because like any other human being, you're seeing a situation where things are going out of hand, and that's where these diseases have led them today. you know and if my Zoom network was working well, I would have also been in a better position to you know share with you the recording of this video. But somehow the recording has been let down by Zoom, and I don't know, is this a audio problem with my system, or was it something else got to do with it? And the doctor spent a lot of time explaining to us, our MBS students, the problem concerned with this disease, and how this disease has impacted a lot of lives across UK and the rest of the world. And a lot of pains they have taken to talk to our class on this, and getting a free advice is very difficult these days, but they spend a lot of time to give us this free advice. And then, as you saw in the picture, we had our director who entered into the room, and Dr. Said is getting ready to share his views on how he thinks about this disease affecting countries. So we had a question from a student asking us about how COVID-19 is affecting India, and somehow, because of the accent, we Indians have a different accent, so the doctor was not able to understand the question well.
No, Dr. Narendra is from UK, so he will not be able to answer questions relating to other countries. And the previous part he had answered this question. So, as I advised Dr. Narendra, he has already shared his screen, and I would also welcome our director to share his views. Put your mic on mute, Dr. Narendra.
So we take over the conversation to Dr. Ahmed Said. Now, Dr. Ahmed Said tells us about how this disease is really impacting countries in the world, how a lot of countries are affected by this disease, and he is also sharing his presentation and thoughts about this, how this disease gets spread through, a lot of, how this disease can spread by touching, how this disease can spread by being close contact with other people, and doctors are doing a big job in fighting this disease. And I'm also really surprised that both these doctors don't consider wearing mask of covering the face very important in their knowledge of this disease. And he was telling us about he being in a, talking about the prophet. And according to their religion, it seems if you live in a country which has an epidemic, you're supposed to stay in that country. And if you hear about a disease in another country, you're not supposed to go there. So that's what he tells about this disease, and that is what people need to do with these diseases. And as you see in the video, the doctor has he's come direct from his workplace. He's spent a lot of time and effort to teach taught students about the importance of how they protect themselves from this disease and so on. So that's what he tried to tell throughout his video, throughout his presentation. This is what the doctor tried to tell, and it's really amazing about how illnesses can spread across the world. And he tells that there is no proven cure for this disease, be it plasma, be it any sort of medicines, or use of medicines like which have been discovered in the recent past. And he says that once you get this disease, the first day you will be having fever, and then it would subside. You should keep yourself and your family in isolation, and that's the way you can protect yourself and your family from this disease, not just in India but across the world. And this is what these doctors strive to do in their daily lives. They spend a lot of time to educate. Education is one of the main activities of a doctor, and that's what these doctors do. And here we have my classmate Dr. Rajan also coming into the group, joining us. So here he is in the picture. I'm meeting him after a long time, and really happy to see him. So the doctor has made a PPT on this topic, on this aspect. He works for King Abdulaziz Hospital in Mecca. Now, Saudi Arabia is one of the biggest countries infected with this disease. Saudi Arabia has something like 2,000 people daily infected with COVID, and on a total, they have something like 35,000 people infected with this disease. So, you're talking about a big country which has a lot of issues with COVID-19. And he didn't talk much about his country, but he said that when you have this disease, you should consider yourself. The only option would be to go for self isolation. But one good advice I think as human beings we should do is as he said in his presentation, is we should use a lot of tools with respect to making ourselves positive. Eat healthy fruits, vegetables, make ourselves positive by, doing a lot of work, by spending a lot of time with our family members, with our near ones, with our loved ones, and use this opportunity to spend time and use it to study well with our family members, use it to go for do things which we have never done before, maybe, you know spend time rejuvenating ourselves, spend time with energizing ourselves, spend time with making our body, mind, and soul happy. That's what the doctor thought we should do. That's, and throughout their conversations, they spend a lot of time in telling how we can keep ourselves positive, and being in a positive state of mind can change things. And across the world, this disease has created so much of issues. You're talking about nearly uh, 212 countries infected with this disease. You're talking about 2 lakh 50,000 people dead. You're talking about countries like United States having 74,000 people infected with this disease. And when I asked left to asking questions, a lot of students ask questions about this disease, getting the virus getting mutated, about this virus having issues with respect to not being able to create a vaccine for this vaccine. Might be long time in hand. Vaccines might take another 1 year down the line, which by that time, which can create a lot of people being dead in the world. So this is all what I could share from you from the notes which I had made about the Dr. Ahmed Said's speech. And he shared, one thing I noticed was these doctors are very optimistic about how they think they can protect people, because at the end of the day they have nothing in their hands which can protect themselves and others from this disease. So this is what uh, doctors have been able to do. Doctors have been able to do a lot of things in fighting this disease, and most hospitals across the world are trained with doctors really, spending a lot of time and effort and in fighting this disease. And hospitals in, in countries like India, a lot of hospitals are strained with having 90,000 people infected across the globe with this disease. So they are also in the forefront of treating this disease and even getting infected because of this disease. So that's the big problem with this disease. But doctor also tried to quell our myths that this disease can be spread through air. And that's another thing which the doctor said: this disease does not spread through air, and this disease does not spread, like most diseases. But what is needed from the person is to prevent it from becoming an epidemic. The person should have good personal hygiene. Even while cleaning the house, the person should use disinfectants, cleaning the washrooms, cleaning the house, keeping things clear. That's what the people should do. And that's what the doctors stressed upon to the class. And a lot of effort was done into all this. and we had questions from our student Salim. Salim had questions about how this disease can be protected by people. How can we as human beings protect ourselves from being infected from this disease by eating good food, by eating good vitamins? And the doctor said there are no medicines to this, but your body immunity can be boosted by having a lot of vegetables and proteins. So that's what the doctor had shared in his thoughts. He had shared how how the body can be protected, and how the body can save itself from its these ailments. That's what the doctor wanted to share in his thoughts. And as you see in this presentation, there's a lot of things which countries, like different parts of the world, a lot of progress these different parts of the world have done economically, but unfortunately they have not been able to protect themselves from these diseases, because what has happened is these doctors, there's not much of investment by most developed countries into healthcare, and that's really surprising. In spite of their economic well-being, hospitals in most developed countries have got the blame. They have irresponsible governments who have not spent a lot of time and effort in building building the hospital infrastructure, hospitals, medical infrastructures. Yeah, and that was the talk about the prophet. What he said about is when you have a disease, you should not leave a country. You should be in that country, and even after so many years of 1500 years, this is a practice which is followed by most countries across the globe when it comes to protecting diseases. And most countries across the globe, are working hard to curb this ailment of this disease. And as you see in the picture, these slides, you can get these slides if you put a comment in the inbox. I would be most happy to share with you the PPTs on these slides. And uh, most hospitals in Arab countries are also having a lot of good doctors, trained doctors from countries like India. And doctor was also praising the Indian government about imposing lockdown since March 25th, which has really helped our country to curb this disease, in spite of a lot of hatred, in spite of a lot of protests from people around the world, uh, and a lot of Indians being, in spite of being not used to the fact, in spite of we being a democracy, we are not used to the fact of going in hibernation for so many days. So these are a couple of the things that the doctor briefly spoke in his conversation, and a lot of thoughts was shared to the class, all his inputs. I think this was one of the best lectures that I as a human being have listened in a long time. And it really helped increasing the knowledge, and it helped in increasing the knowledge about how this disease can be in a situation for spreading to the people. and these are some of the things he said: how infection rates have gone up and how soaps can protect people. He said either soaps or sanitizers can be used by people, and this can be used in running the show. And as my 40 minutes got over, I was not in a position to do any more Zoom, because my 40 minutes got over, and we had to come back. We had to create another new Zoom ID, new password, so that we can launch this programming again. And within a few minutes, as you see in the PPT, as you see in the picture, I came back to the presentation of this whole aspect. And with this, I would like to stop my video, and thank you for those who watched my program, and hope you all had a good explanation. But the basic things need to be followed are hand washing, cleaning hands, cleaning, protecting oneself. These are the things which can help us, prevent us, and protect us from this disease in the long run. So that's what the doctor had to tell to our class. And hope you all have a nice time listening to this conversation about COVID-19 and presentation by